MACRA is something that people either don't know about, or they do know about it and they hate it, or they're being protected from it. As we've heard probably before, it doesn't look like it's going to be something that the solo and small group practices are going to be able to implement. Hundreds of thousands of people will lose their physician. It's devastating, and the effect is going to take its worst out on the patients. My feeling about MACRA and how it's going to affect the patients has to do with the way it's going to affect their doctors. This is one in a series of changes that have been made by the government in controlling what we do as physicians to try and have their doors open for people who need them. So there's another hit, another rate cut, and they just will not be able to cope. Some of my friends complain that they don't think they'll be able to keep their practice doors open, and they are quitting. We have, at this point, so many laws and regulations that we're supposed to follow that with the new MACRA implementation, it's a perfect storm. It's going to make it so that people are unable to practice medicine. The unfortunate thing is that people really don't understand what it is to be a physician. We are ingrained with this feeling of compassion and care. One of the most devastating things is being told that we have to be measured. Our quality of care has to be measured. When we're so hard on ourselves as it is, people actually commit suicide having issues like that come up with patients not being cared for well. If they could only understand from my side, I think they would really believe that this was unnecessary. So MACRA being a combination of quality care, increased access at a good price, I think they're actually completely messing up on two of those. Quality of care, I believe physicians spend their lives learning how to care for patients. Physician burnout is an incredibly big problem right now. The other problem is when people are forced to close their clinic, is that it affects the community, the whole community, not just the patients. Physicians don't need to be controlled. It's unfortunate that the government feels this need to stick boundaries on us. If those people who actually made up this silly law would think about what they're doing, both in terms of collecting data and limiting access for their patients, I think that they may have a little bit better way to make this all work together.